Ladies and gentlemen, COVID time is hard for everyone, but for some it is harder than others. We are in the same storm, but not in the same boat. So fighting inequalities is again high on the political agenda because these have been increasing, these inequalities, in recent decades. COVID-19 brings new inequalities on top of the existing ones. Not everyone can protect themselves from the pandemic in the same way. Remember the lack of mouth masks at the beginning of the first lockdown. Elderly people in nursing homes were much more exposed than others, especially those living in large units. People who cannot telework are more vulnerable than those who can work from home. Families with a garden experienced a more bearable period than those who have to work remotely with children in a flat. And the list is long. I am not even talking about those who lost their jobs or lost their lives. A lot of creativity, innovation, and resilience, solidarity has been shown by many to make the best of it. All attention has rightly been and continues to be focused on those most physically affected by COVID and most likely to even die. There are almost 500,000 deathly casualties in Europe. But that does not alter the fact that fate also struck elsewhere, mentally and in other ways. The European Union as an institution has almost no competence in the social sphere unless it is supplementary and coordinating. The European Parliament, the Council, and the Commission proclaimed the European Pillar of Social Rights in 2017. It consists of 20 principles that have guided us ever since towards a strong social Europe. Its implementation depends very much on the cooperation of the member states. And nevertheless, it was an important step, and of course, implementation is key. Although the Union is not really competent on health, it reacted relatively quickly by setting up a fund mechanism to support the social services sector, but these funds have still not reached the sector. Often, the member state level turns out to be the bottleneck. In general, solidarity is a crucial value for the Union. The Corona crisis showed this once more. The European Recovery Fund is a real breakthrough because it involves a huge amount of money, 750 billion euros, 390 of which are donations, non-refundable gifts. So it's a breakthrough. And because also the target group is those countries and regions most affected by the pandemic. Negotiating these was difficult precisely because it involves solidarity. Another example is the European procurement for vaccines. The intention here is that every member state, large and small, should have equal access to vaccines. If all member states come out of the crisis together, they strengthen each other and the economic impulse is all the stronger. Ladies and gentlemen, this crisis has also shown how important health is, both physical and mental. Today, social services, home care, facilities for the disabled, care for children, poverty reduction, and many others. So today, social services already represent 5% of the working population, or 11 million people. And together with the pure health sector, hospitals, these services employ over 11% of workforce in the European Union. The increase here over the last 10 years has been 24%. The aging of the population will further reinforce this trend. The contribution of millions of volunteers across Europe can also not be ignored, especially from the perspective of social cohesion. And indeed, also professionals should be better recognized and valued for their contribution to society. these citizens dedicate their careers to helping others live a better life. But in the past decade, healthcare has sometimes been blindly economized on, with the consequences that entails today. One of the most important benchmarks for the corona policy was and is the capacity of hospitals and especially intensive care units. Today, it is feared that this scenario of austerity will be repeated once the pandemic is over and efforts must be made to reduce the budget deficits. However, it is not about less money, but more money. The economic and social impact of this crisis is also expected to lead to a higher demand for social services than prior to the COVID-19 pandemic. And therefore, in its new recovery fund, the EU should not only consider the digital and ecological transformation, but also the social and human capital. I repeat, the pandemic has shown the importance of collective goods for all, but especially for the most vulnerable. There is, of course, not just one single social services ecosystem in Europe. However, all require further strengthening and improvement. The European Union needs to play a stronger role in the development of social services ecosystems, for instance, in funding, policy guidance, monitoring of progress, support to social dialogue, and legislation where appropriate. Such EU action is crucial if it is to strengthen social convergence, cohesion, and resilience across Europe, and to ensure the European pillar of social rights becomes a reality irrespective of where one lives. Ladies and gentlemen, I sincerely hope that the conference on the future of Europe, which starts on May the 9th, will pay sufficient attention to the competences that be in the field of health. The aim of the policy remains to give people a good life. I would add, a better life. That must continue to be our goal, doing better and better. Let us already draw the conclusions from this unique and tragic experience of the last year. I wish you a fruitful dialogue this afternoon on how to make the EU stronger by making it more social. Thank you so much.